the issues that are arising from the very serious situation that is here in Sydney. I've got to start particularly by extending my thoughts to all fellow Sydney-siders who go into even firmer restrictions as of this evening, and just simply say that we'll get through it together. This is a very necessary set of restrictions that have been put in place by the New South Wales Government. Strongly support them, and the Commonwealth Government will continue to provide the support necessary to give effect to those restrictions and to ensure that the New South Wales economy and the people of Sydney in particular are supported through what is this very difficult time. Many other cities, particularly down in Victoria and Melbourne, have gone through this before, and Sydney-siders, I have no doubt, will continue to push through. I know it's tiring, I know it's exasperating, I know it's frustrating, but we need to keep pushing through. And so my thoughts are with all of my fellow Sydney-siders today. The meeting of the National Cabinet today considered a wide range of issues, most of which was following through on decisions we'd taken previously and updating on those actions. In particular, in addition to getting updates from the New South Wales Premier on the situation here in New South Wales, and other premiers were very fulsome in extending their support to New South Wales, just as New South Wales has done in so many other cases when other states have found themselves in difficulty. One of the pleasing elements of the report we heard today was the flow on from the Tanami mine issue, where we had a worker who'd been through Queensland and into the mine. That outbreak has been able to be contained. That was one that was very seriously concerning us over the last couple of weeks, and so the practices put in place by the mine operators there proved to be very effective and very helpful, and we thank them for the way they did that. And it's a reminder that across so many workplaces in Australia over the course of the pandemic, very good COVID-safe practices have been put in place, and that has enabled particularly our heavy industry to keep operating safely. And on this occasion, where there had been a breach, still, because of the practices and processes they had in place, it meant that that could be tracked down very, very quickly. We're also noted today that in our own region, not only here in Australia and here in Sydney, but not far from Australia, particularly in Indonesia and of course in Fiji, they are facing even more serious circumstances. And in both cases, the Commonwealth Government, Australian Government, has been reaching out to provide that support to both Fiji and to Indonesia. And I was in contact only this week with the Indonesian President Widodo, only this week to that end. We noted that the Doherty Institute would be coming back to us over the course of this month. The First Secretaries Group, which is the heads of the Director Generals of the Premier's departments and my own Secretary of my own Department of Prime Minister and Cabinet, will be pulling that work together of the Doherty Institute. That will actually set out what the spectrum of risk is across various levels of vaccination in the population, and what the levels of vaccination in high-risk vulnerable groups are, and what the risk is then associated with COVID being in the community. That information will be combined together with the capacity of the health system and the advice of Treasury and Treasury secretaries around the country to ensure we get the best assessment of what the thresholds are to move from phase 1 to phase 2 to phase 3 and ultimately phase 4, which I outlined to you last Friday. So that work is in process. The Doherty Institute are continuing that work. On the vaccine rollout today, Lieutenant General Fruin was able to update the National Cabinet on the arrangements that have been put in place with Pfizer, which is bringing forward those vaccines out of our vaccine purchases, which were to be in place over the course of the year, and the new horizons, as they're defined by Lieutenant General Fruin, have been advised to the team leads in each of the states and territories on the projected distribution from those new brought forward supplies that will come available this month. That will see us rise to 1 million a week. That will see us move from 2.8 to over 4.5 million doses coming in from Pfizer in August. This is going to greatly assist the further rollout of the vaccine program. And today we have again seen very strong numbers when it comes to the vaccine program. The vaccine numbers that have been released today showed the second highest day yesterday that we have seen, some 164,773 doses administered. That gets us to 8.8, or rather 8.9 million doses as present. That would likely see us hit 9 million doses by the end of this week, most likely by the time we report again tomorrow. And so we will then be hitting that very important mark of 1 million doses every week. You hit your marks there, you hit your straps on those sort of a vaccination rollout, as we are now achieving, and that puts us in a very strong place to be able to get this job done as we move towards the end of the year, and indeed perhaps sooner than that, to ensure that everyone who was seeking to have a vaccine would be able to have one. We also reported today, importantly, and did a stock take, and that will continue over the course of the next week in terms of our health system capacity. Now, what I'm referring to there is, you'll recall at the start of the pandemic that one of our key issues was ensuring that we had sufficient respirators and all of that equipment in place in the event of a very serious outbreak. Now, what I was able to report today is that the ICU capacity currently has Australia with 2,020 spare ventilators nationally, with an expansion capacity of some 7,500 ventilated ICU beds to treat hospitalised COVID-19 patients. Now, the states and territories, this will be a continued standing item on our national cabinet agenda to ensure that we have been able to maintain that health system capability to deal with any potential outbreaks. And there were no concerns expressed today by premiers or chief ministers in terms of their preparedness of their hospital networks to deal with any potential outbreaks. And the hospital capacity here in New South Wales, in Sydney in particular, is proving to be more than up to the task of what is currently presenting. Also note, this Sunday, and Lieutenant General Film will have more to say about that on Sunday, there will be a new campaign launched in relation to the vaccination program. This is the next phase of those communication campaigns. It coincides neatly with the additional supply that has been brought forward to support the vaccination program. On aged care, today we received the final presentations to Lieutenant General Fruin in terms of the InReach and Hub systems being put in place to support vaccination of aged care workers. We also discussed an incentive system today that was suggested by Premier McGowan, which I think is an excellent idea. We'll be engaging with the corporate sector as to how that can be put in place to incentivise aged care workers as another way of ensuring we lift those levels of vaccination amongst aged care workers. I had confirmation from all states and territories except Victoria today that they would be introducing public health orders to mandate the vaccine for aged care workers. I stress, though, that in Victoria that is not a decision of the Premier or the Minister. Under their legislation, that is an independent, a statutorily independent decision of the Chief Health Officer of Victoria. So that person is the only one who is authorised to decide whether to put in place a public health order, and so I would have to refer you to the Chief Health Officer in Victoria as to what his intentions are regarding the mandating of vaccines for aged care workers. There was also papers received from the medical expert panel that dealt with the vaccination of disability care workers, and while they're not at this point recommending mandating of the vaccinations for disability care workers, they are strongly recommending it, and so with that corporate program that can be used to incentivise vaccinations for aged care workers, we would look to extend that to disability care workers as well. We also considered for what are called mobility workers, those working in the air transport sector and other transport sectors, as to whether there was a requirement for mandatory vaccinations there. That is not being recommended at this stage, but of course across all the community where you're able to get those vaccinations, then of course we strongly encourage it, particularly when you're working in an area which would bring you into contact with more people. We also agreed today that a national cabinet pilot would be established for home quarantine. That would be done in a lead jurisdiction, and South Australia has indicated their intention to go forward as the host jurisdiction for that home quarantine trial, which would be a 2-week quarantine period based on the advice received from the medical expert panel, and we'll be working with South Australia to put that pilot in place as soon as possible. That will be a transparent project with all the other states and territories. It will be run, of course, by South Australia, but with the active engagement and visibility of all the other states and territories, so they are in a position to pick up that project on the completion of a successful pilot program. In relation to inbound and outbound travel, on inbound, since the announcement made last week, we have 29 now scheduled facilitated commercial flights that will be going into Darwin. That should see us taking in around 4,000 people a month into Howard Springs and fully utilising ultimately the quarantine capacity at the National Resilience Facility at Howard Springs. And I thank the Northern Territory Government for their close cooperation in getting those arrangements in place. We will also have the Australian Travel Declaration, which will be from the 16th of July. We'll be including information on inbound arrivals vaccination status. That will be done through what is called attestation. This is not linked up to other international databases at this stage. This would be requiring people to attest whether they have received a vaccination, the vaccination that they have received, the date of that vaccination, and the jurisdiction in which they received that vaccination. That will provide information, particularly to the states, who will be in a position then potentially to look at how they're managing quarantine operations in their state, as indeed the Commonwealth can with the Northern Territory Government at Howard Springs, to look at ways that vaccinated and non-vaccinated travellers can be treated in the quarantine program. Obviously, those who are vaccinated have a much lower risk of infection than those who are non-vaccinated. And finally, on outbound, it will be our strong preference for those who are given an exemption, and there are very clear and limited reasons why people are able to travel outbound presently. That is our strong preference that people will be vaccinated if they're travelling overseas. That reduces the risk both to them personally, because as we know, COVID is riddled through many countries around the world and many of the places Australians would be travelling to. And that also, of course, reduces the risk of when they return to Australia. Now, for those who are unable, for medical reasons, to receive a vaccination, or at this point in the cycle they may not have access to that vaccination, well, there are obviously issues that will be taken into account by the Border Force Commissioner in considering those arrangements. Now, those last points that I make about outbound travel, the facilitated commercial flights, the Australian Travel Declaration, they are all decisions of the Commonwealth Government, and they were noted today by the National Cabinet.